Imagine a ruptured pressurized pipe. Without an immediate patch, the fluid drains out and the entire plumbing system fails. A damaged blood vessel faces the exact same mechanical stakes. Before any long-term repairs can happen, the smooth muscle lining the vessel wall physically constricts. This vascular spasm pinches the pipe to slow the leak. With the flow reduced, a molecule called von Willebrand factor acts like biological double-sided tape. It coats the damaged surface and catches free-floating blood cells called platelets as they drift past. Once captured, these platelets activate. They change shape, grow spiky appendages, and latch onto one another, packing tightly into a loose, temporary plug over the rupture. This immediate physical spasm and platelet plug stop the initial bleeding. However, they are too fragile to hold against the pounding pressure of arterial blood flow. The body needs a much stronger chemical seal. Upgrading that fragile platelet plug into a rigid seal requires a complex microscopic chain reaction. This diagram maps out that exact reaction. It shows the coagulation cascade, a massive, highly organized biochemical factory floor. The factory relies on two distinct alarms. If damage occurs purely inside the blood vessel, exposing the damaged surface trips the internal alarm, initiating a domino effect that starts right here with factor 12. Conversely, if the injury involves external tissue trauma, like a deep cut, it triggers a separate, much shorter chemical sequence. This is the external alarm, driven by tissue factor. Having these redundant alarm systems, one for internal damage and one for external wounds, ensures that the body never misses an opportunity to initiate its life-saving chemical response. Notice that both of these alarm systems ultimately converge on a single critical bottleneck where the pathways merge. Let's pause to test your understanding. If an internal injury triggers the left side of the pathway, but there is zero external trauma, what is the final gatekeeper factor that the cascade must hit to proceed? The answer is factor X. Once activated, factor X pairs with factor V to enter the common pathway, producing a highly active enzyme, thrombin. Thrombin operates like molecular scissors. It slices floating fibrinogen proteins into fibrin, the permanent biological concrete that locks down the platelets. Notice these dashed green lines looping backward. Thrombin actually sends signals up the chain to drastically accelerate the earlier chemical reactions. This creates a massive positive feedback loop. Thrombin acts as a master amplifier, exponentially accelerating the construction of the structural clot before blood pressure can blow out the temporary plug. Even with redundant alarms, the system is highly sensitive to the strength of its individual links. In hemophilia, a single missing component, like factor 8 or 9, stalls the internal pathway's momentum. Without these factors, the internal alarm fails to reach factor 10. This cuts off the sustained production of thrombin needed to create a lasting, high-volume supply of fibrin concrete. Because the body relies on this specific sequence to reinforce the clot, losing one pathway means the factory can't keep up with the leak. The external alarm might start the process, but without the internal reinforcement, the seal never reaches full strength, and the initial platelet plug eventually washes away. There is an equal systemic danger on the opposite end. If that powerful amplification loop isn't stopped, the cascade will pave over the entire interior of the blood vessel, causing a heart attack. Looking back at our diagram, the dashed red lines map out the body's natural braking system. These inhibitors neutralize active factors to contain the clot precisely to the injury site. You can see TFPI blocking factor 7, while antithrombin shuts down factor 10 and thrombin. When doctors need to forcefully stop a runaway clot, they use drugs like heparin. Heparin acts as a booster rocket, supercharging the body's natural antithrombin to shut down the cascade. Survival requires a perfect biological balance: vascular spasm to slow the leak, platelets to plug it, a chemical cascade to pour the concrete, and a robust braking system to know exactly when the job is done.